Hey everyone, welcome back to Malaysia in Focus, where we break down the stories shaping our nation. Now, we all take pride in Malaysia's healthcare system, right? But what if I told you that just beneath the surface of our world-class care, there's a silent financial crisis brewing, one that's turning medical emergencies into financial catastrophes for entire families? Because what you're about to see changes everything we think we know about the true cost of getting sick in Malaysia.
Okay, so here's how we're going to break it all down. First, we'll look at the promise of our healthcare system. Then, we'll dive into that tough choice between public and private care. After that, we'll uncover this hidden thing called the medical inflation bomb and see the real, devastating cost of sickness for families. We'll also ask, is our safety net actually enough? And finally, we'll look at where our healthcare system is headed.
All right, so for decades, we've heard it, right? Malaysia has one of the best healthcare systems around. We've got this idea of a top-tier system that everyone can access. But the question we have to ask is that promise still true today?
So our whole system is built on this two-part model. On one hand, you've got public healthcare. It's super affordable because it's heavily subsidized by the government, and it's there for every single Malaysian. The catch? Well, as many of us know all too well, you could be facing really long wait times in crowded hospitals. Then you've got private healthcare. You get fantastic care, shiny new facilities, and you get to see a doctor almost right away. The downside, of course, is the massive cost. It's that classic dilemma, you're trading your time for money.
So just imagine for a second. You get a call about a family member. It's a worrying diagnosis. And boom, right there, you're hit with this huge, heavy decision. Do we wait it out in the public system? Or do we scramble to find the money for the private one? You see, this isn't just a medical choice, is it? It's a massive financial one.
And this is where the numbers really hit you. I mean, look at this. A visit to a specialist that might cost you, say, 200 ringgit in a government hospital could easily be 3 times that in a private one. And the scans, my goodness. An MRI can jump from maybe 800 ringgit to 4,000 ringgit. These are not small changes. For so many Malaysian families, these numbers right here make the decision for them.
And listen, it's not even about the final bill. That's a whole other story. It's the hurdle you have to jump over just to get in the door. The upfront deposit. Before a private hospital even admits you, you might have to pay 10% of the estimated bill. So for a surgery that's going to cost 17,000 ringgit, you need to find 1,700 ringgit right there on the spot. How many of us have that kind of cash just sitting around for an emergency? Okay, so we've established that private care is expensive. We get it. But there is a bigger, almost invisible force at work here, making everything, public and private, more expensive. Year after year after year. It's like a hidden enemy lurking in every hospital bill. And this enemy has a name. It's called medical inflation. It sounds complicated, but the idea is actually simple, and its consequences are huge. It's just the rate at which all healthcare costs, doctors' fees, medicine, hospital rooms are going up. The best way to think about it is like a financial fever. The rest of our economy might have a normal temperature, but our healthcare sector is burning up, with costs rising way, way faster. And this is the real aha moment. Just look at these numbers for 2024. General inflation, the price of groceries and stuff, is about 2 to 3%. That's pretty normal. But medical inflation in Malaysia? It's a staggering 15%. That's not just a little high, it's way above the global average. Our healthcare costs are rising 5 to 7 times faster than everything else in our country. So what does this actually mean for you and me in real life? Well, let's play it out. Say a major surgery today costs 30,000 ringgit. Okay, that's a lot, but maybe it's manageable. Now, with that 15% inflation year after year, in just 7 years, by 2031, that exact same surgery could cost you almost 80,000 ringgit. It goes from being something you could afford to something that's completely out of reach. That's the terrifying power of this compounding cost. So you've got to be asking, why? Why is this happening? Well, there are a few big reasons. First, more and more of us are dealing with chronic diseases like diabetes and heart problems, which need expensive, long-term care. Second, a lot of our high-tech medical gear and medicines are imported, so when the ringgit is weak, prices go up. Third, as the public system gets more packed, everyone who can afford it rushes to private care, and that high demand just pushes prices higher. And finally, there's a real problem where sometimes what a patient is charged for isn't perfectly aligned with what they actually need. If this breakdown is giving you a clearer picture, hit like and subscribe so you'll always stay ahead on Malaysia's biggest issues. Now that we get the big picture pressures, let's bring this right back down to the ground.
What does all of this actually mean for the bank account of a normal Malaysian family when someone gets seriously sick?
This chart is honestly, it's pretty shocking. The government pays for a little over half of the country's total health bill. But look at that other big piece. A massive 38.6% is paid out of pocket. That means it's coming straight from our own pockets, from our savings. For every ringgit spent on healthcare in Malaysia, almost 40 cents is paid for directly by an ordinary person.
And the result of all these out-of-pocket payments can be absolutely brutal. This quote from a research study makes a direct and really worrying connection between medical bills and bankruptcy among young people. Think about it. A sudden health crisis hits. They have to empty their savings, maybe take out loans, and they get trapped in a debt spiral they just can't escape. And that leads to this truly heartbreaking trend that researchers are now calling intergenerational debt. We're seeing more and more young Malaysians just starting out in life taking out personal loans, not for a car, not for a down payment on a house, but to pay for their parents' medical treatments. They are literally beginning their own adult lives already deep in debt because of the health crisis of the generation before them. And for the families who are already struggling, the impact is just devastating. One study looked at low-income cancer patients and found that after paying for treatment, the number of families living in poverty shot up by 11.1%. This isn't just a financial problem. For many, it is a direct line into poverty. One diagnosis can completely destroy a family's financial security. So when you're facing these kinds of crushing costs, what's there to protect you? Well, the government does have safety nets in place, especially for the most vulnerable. But let's take a closer look and ask the hard question. Are they really enough? The main one you'll hear about is the PECAR B40 scheme. It's designed specifically to help the low-income B40 group, and it focuses on something super important, catching non-communicable diseases like cancer and diabetes early on. The whole idea is to find these problems before they become a full-blown medical and financial disaster. And the process is meant to be pretty simple. If you're over 40 and you receive the Simbangan Tunai Rahma, or STR, you're probably eligible. You just have to find a clinic with the PICA B40 logo. Go for a free health screening, and from there, a doctor will tell you what the next steps are if they find anything. And to be fair, the scheme offers some real, tangible help. On top of the free screening, you can get assistance for medical equipment. We're talking heart stents, wheelchairs, things like that, up to 20,000 ringgit. There's also a 1,000 ringgit incentive to encourage patients to complete their cancer treatment, and it can even help cover your transport costs to get to the hospital. But here's the thing. While the idea is great, experts are pointing out some major problems. This quote really sums it up. The scheme is good for basic screening, but the follow-up care is very limited. Plus, not many people even know about it or how to use it, so the number of people actually using the scheme is really low. It's a safety net, for sure, but it seems to be one with some pretty big holes in it. So when you put all of these pieces of the puzzle together, the high cost of private care, the overcrowded public system, the insane inflation, and a safety net that's struggling, it's pretty clear. Our healthcare system is standing at a major crossroads. And this last image really puts our entire situation into context. If you compare Malaysia to other countries with similar economies, you see that the total amount we spend on healthcare as a piece of our whole economy is actually pretty low. We have this high-quality system that we're proud of, but as a nation, we're actually investing less in it than our peers are. It's like there's a big gap between the amazing system we want and what we're collectively willing to pay for. Thanks for watching. Join thousands of Malaysians who want clarity, not confusion. Tap like, hit subscribe, and let's keep making sense of this together. And all of this leaves us with one final massive question. With costs soaring out of control and our safety nets stretched so thin, how do we fix this? How do we, as a country, make sure that getting sick in Malaysia doesn't automatically mean becoming poor? That's the challenge that's staring all of us right in the face.